What's up, you guys? All right, it's Bridger here. It's Thursday, February 25th. Like I said, it's an online recorded lecture today. We're not in the classroom. I would, if we were in person, if we were all in person, we would be able to do this, but I know lots of you guys do not have a foam roller at home. That being said, I will go over some foam rolling exercises for you guys. At the later part of the video, the first part of the video, I will discuss what foam rolling is, what self-myofascial release is, the benefits, kind of the science or both sides of the spectrum. There's a lot of arguments of whether it's beneficial, whether it's not, how much you should be doing it, etc. Okay, so that's going to be the most important part, and then give you some actual exercises to apply for foam rolling if you're interested in that. Okay, so if you have a foam roller at home, feel free to try this. If you just did a hard workout yesterday, maybe you just want to change something up. Okay. But to begin, what is foam rolling and self-myofascial release? So this is like, a lot of people call it the poor man's massage or manual therapy. So basically we're massaging or releasing the fascia, and we're helping lengthen and realign that fascia if it's too tight, because that's the fascia we've talked about is what wraps around those muscle fibers. Okay, and so when those muscle fibers become super tight, this helps trigger or release some pain temporarily. It can increase circulation, and it can also increase our blood flow, okay? So now what I mean temporarily, this is super important to understand, and the fact that when we want to foam roll, science shows that it produces, and studies show that the best way to do this is to do it maybe before workout to release some DOMs or help your DOMs out, so delayed onset muscle soreness we talked about. Before workout, you may see some acute benefits of that. You have a little bit more blood flow, circulation going on, and releasing some of that pain before workout. But from a performance standpoint, foam rolling is not going to do it for you. It's not going to make you a better athlete. It's not going to help. Like I said, before a lift, maybe you do a little bit more weight, but from an overall standpoint, it's not the medicine that cures all, okay? So talking about this further, it's going to improve mobility for the short time being, okay? It may be 10, 15 minutes or so. Like I said, increasing circulation, blood flow. It may temporarily increase your flexibility, and it's a relaxation technique, and it's a feel good, okay? And it can reduce soreness for a training session, like I said. But what it does not do, it does not heal muscle strains. It doesn't take away any muscle knots. It doesn't decrease muscle adhesion. It does not push any lactic acid out of muscles. That's what a lot of people think is a big benefit for it. It does not do that. It doesn't temporarily reduce the soreness over a long period of time, okay? It's short, quick, and fast, okay? I think it's beneficial sometimes, like I said, if I'm a little sore, want to help that fascia out before a workout, release some of that pain before I go maybe do some sprints, or if I'm doing some powerlifting, okay, I think it's beneficial then. But we'll kind of go over a little bit more. I think there's both sides of the story. Some people are all for it, okay? People maybe who don't know as much in the field about it, but I think overall the benefits, it's kind of you got to play with an experiment. If it feels good to your body, placebo's real, so if it feels good and it's what works for you, then maybe do it a little bit more. But foam rolling's good, and we'll talk about static stretching next week. Static stretching, if you're really into strength, has kind of shown a little bit in a way to decrease strength performance in ways rather than foam rolling does not. So, and it actually helps, like I said, get out, trigger, release, increase blood flow. So it does have some benefit and less risk when we're talking about strength production in that terms. Going forward, I'll give you guys some exercises, so take that information however you perceive it, okay? I think it's important to know the benefits of it, know what it does, okay, why you're doing it, okay? Some people religiously foam roll every day. It's not gonna give you an upper hand, I don't think, any more than a person who's not foam rolling. I think in moderation, anything is, good. So apply it, try it. I think it's good. It feels good. Relaxation. If you want some kind of myofascial release, some kind of manual therapy, if you can't go get a massage right now due to COVID, okay? So foam rolling is really cool, and we're gonna get to it. So here we are. We're gonna do the calves first, all right? So take my foam roller here. There's short ones, there's really long ones. Okay, this is a shorter one here. Put it down on the ground. I'm just gonna sit on my butt. Make sure you guys can see me. Perfect. Cool. So what I'm gonna do here is I'm gonna raise up on my hands, okay? And now I'm just gonna roll back and forth. I probably wanna do this for maybe 30 seconds on the foam roller for my calves. And I'm just gonna go internal rotation with the foot and external rotation. So move over here more. See my foot go internally rotated, okay? And externally rotated. So we're working the gastroc, okay? We're getting some of the soleus. And then what I really wanna do is now after about, I've done 15, 20 seconds, I wanna get into the Achilles a little bit more, okay? So now I'm gonna go plantar to dorsiflexion, okay? We're working within the Achilles area, region, okay? And then after we've done that, I would switch legs. I'm not gonna switch legs for the purpose of this right now. In time, I don't wanna keep you guys here forever. But I would wanna hold, okay? So it's good if I have really tight, I just went and hiked Mount Humphreys. And my calves are absolutely just sore. Doesn't feel like I can climb up a flight of stairs. So maybe I wanna come here and just release some pain. So just hold for 30 seconds. So I'm getting good internal rotation, all right? And I'm just working right here in the calf region, holding for a second, probably like 30 seconds. Okay, like I said, getting warmed up, maybe good before a workout. If you're trying to do a workout the next day, increase that blood flow, give some circulation, and a little temporary flexibility before you get into the workout. Okay, so those are the calves. That's the first part. Next, we will do our IT band. So this is maybe one of the most common ones you see on a foam roller. Can also be one of the most painful exercises as well. Okay, the IT band and the TFL, the tensor fascial latte, gets really tight. And so remember, the IT band inserts right around the patellar tendon. We're gonna go up to the hip joint, okay? So while we do this, go here, okay? And I'm gonna go down and I'm gonna come up, okay? So I'm gonna work within the whole IT band region. I'm gonna just roll around here, getting a good stretch. It does sting a little bit, burns. Whew. Okay, and then I wanna go to a little above the upper third of the IT band. I just wanna hold there for 30 seconds. So I'm just gonna hold for 30 seconds and then release and go back down, okay? So right around that patellar tendon, right above it, okay? Above the knee. And then, like I said, we're gonna hold everything for 30 seconds. Next, we're gonna go into the quads, okay? So we'll be facing down on top of the foam roller here. I'm gonna go right above the knee. Okay, I go up on my elbows, bring one leg, the other leg out, and now I'm gonna roll it. I just hit my pen. Roll it here, and I'm getting way up into the hip flexor, okay? So working those four heads, okay? Working rectus femoris, the vastus lateralis, the medialis, and intermedius. Sorry, spacing on all of those. But yeah, we're working all throughout the quad. You can change your angle. So if I want more of the vastus lateralis, I can go more on the outside. So I'll come here, maybe bring my foot internal rotation in. Now I'm working the more outside of the quad area, getting near the IT band a little bit more as well. Okay, but I'm putting a lot of pressure, all my body weight's coming down on the foam roller, going back and forth, getting good stretch there. Okay, so that's our quads. If you guys have any questions about any of this, let me know, reach out to me, email me as well. Okay, then we're gonna go into the hamstrings. The hamstrings, I wanna sit on my butt actually, okay? I can have like high risers. Sometimes I use high risers or put dumbbells down. I'm just gonna use my fists if you have wrist problems, okay? Now I'm gonna roll out on the foam roller, okay? And now same thing, internally rotating and externally rotating the hip. I'm working different heads of the hamstrings, okay? So my main brainus, we got the biceps femoris, the long head and the short head of the hamstring, okay? And we're just working around there. Get a good stretch there. Now stay really tight on that short head of the biceps femoris, right around here. I can just hold here for 30 seconds, get some release, keep that leg up, okay, and get a good stretch to that. And then, after we've done the hamstrings, we're gonna go to inner thighs, the adductors, okay? So now, what we're gonna do here for the inner thighs, foam roller is gonna go parallel to the body, right? Okay, we're gonna come out here, like so. Oh, maybe I'll come out here with my leg up. But basically, I'm gonna come here at 90 degrees with my knee, and I'm just stretching that inner thigh, the groin area, the region, okay? And now, if I want, I can even bring the foot up a little bit more. And now I'm getting a really good stretch in the hip flexor as well. So I'm killing two birds with one stone. I'm releasing some pressure within our adductor brevis, magnus, okay, and there, those muscles, and getting good use of the hip flexor as it comes out. All right? Now if I want to hold for 30 seconds, okay, I can bring the foot up a little bit more, change the angle, bring it down here, kind of go back and forth. Play with that, as you can tell there. Okay, so that's our adductors, the inner thighs. What else was I gonna get over? Glutes, yes. So the glutes, we're gonna be sitting on it this time. Okay. One foot here, okay? You can do two legs here if you want, and you put more pressure on your glutes, but I like to isolate. One leg out here, okay? And now I'm just rolling, okay? And now I can change the angle as well. So if I want to work more of that glute medius, can go more on the outside here. Now I'm gonna rotate this leg in, okay? Now I'm working that outside there. Maybe we just did a bunch of lateral lunges or lateral squats with weight, okay? The barbell behind our head and we're sore in the glute medius. This could be a good one right here, just for some quick release, all right? Help it feel good for a little while. Okay, and then we'll go to the other side. Now, holding for 30 seconds, you can sit up too, and hold right, it's like right under our tailbone, or like right above it and right below it. We can just massage here back and forth, okay? Bring the knees up, and then if I need to, hold. Single hold for 30 seconds, okay? Then I want to lift the leg up, try to apply a little more body weight to it, come a little more upright as well in that position, okay? For the glutes. Let's see what else do I have for you guys. Upper back. So we're gonna go to the upper back, rhomboids, traps, okay? Work some of that. A lot of people have probably done this before. This is one of the most common ones for the foam roller. Foam roller, going up here, okay? The rector spinator loves this one. Okay, now I'm gonna roll it out, and I'm gonna get back to the midline, about C7 or so. Now I'm gonna come back up. And now it's just gonna give me that stretch throughout the shoulder blades and the scapula, okay? Now if I'm tight, got impingement within the scapula, okay, I can hold here for a second, for 30 seconds. It's almost better too with the foam rollers that have, they're like more traction. Okay, that could be better if you've got a very tight now you want to hit trigger a certain point. Okay, we'll hold, now roll back up, okay? Back and forth here. Okay. Feels pretty good. And I'm not going super low, okay? Don't need to do the lower back, only till now, okay? Lower back now. Move it closer down to my glutes. Now the lower back, okay? I can roll here. I like to keep my hands up. And I'm just rolling here. Pretty simple. Back and forth. Okay. Relieving some pressure within the lower back. Okay, I think the upper back is really good. For anyone who's at a desk all day like you guys are with doing classes, where you're really forward shoulder roll, okay, bringing everything back, with your hands and arms as I was with the upper backs. Really good, opens up the chest a little bit more, reminds you, okay, we can't be chest forward, shoulder rolled the whole time, okay? So that being said, we'll move on to the last two. We've got the lats here. The lats here, back and forth. So utilizing that, getting a good roll, pretty tense too. Like I said, we can hold for 30 seconds if needed. I'm just gonna hold here. Can rotate that hand out, rotate my chest as well if I need. Okay. Now I can roll forward, okay? Now working more on the serratus. Now I'm into the serratus a little bit more. Now rotating out with that scapula. Now engaging lats, okay? Getting good stretch there, pinpoint for 30 seconds if needed. All right, the last little thing I'm gonna show you is with the tennis ball too, because we can do self-myofascial release with a tennis ball. We can work with like an upper trapezius area. We can work with the legs. We can do any kind of trigger there if needed be. So let's just put you guys over here next to my whiteboard. See if that works. Perfect. Try to get a squat here for you guys. Okay, so rest it a little below, right around the trapezius, and now I'm gonna rotate, okay? It's around the midline here. I would really do this standing up, but I've got a whiteboard in the way. Okay, and I can just stick with one shoulder, so right now, can't see the tennis ball, but it's behind, right above the right scapula, and I'm just working around like tiny little circles within the upper trapezius, okay? Working on those middle fibers as well. Just roll in there. You can go a little farther down, so now I hunch back a little bit farther down. Now I'm getting more use of the rhomboids here. Okay, got any nice tightness there. Getting some blood flow and circulation. Same thing on the other side. Okay, just rolling on that rhomboid. Put it farther up, all right, here for the trapezius middle. Going out lateral too as well. Okay, feels pretty good. Get stretched. Tennis balls are great for lots of things, whether you're doing hand-eye coordination, obviously, many different exercises, but it also could be used, put in a suitcase, throw it anywhere where you can just, all right, I'm tight for a race, I'm going traveling somewhere, I've got a competition, maybe just relieve a little bit of pain, 15, 10 minutes before. Like I said, it's that acute bout with any kind of self-myofascial release or even foam rolling ahead of time may help you out a little bit, get blood flow circulation in there, but it's not a one cure fix all. You know, you just went and did a hard strength training session, you haven't worked out in a long time, you experience very bad DOMs, it's not gonna fix that, okay? It's not gonna it'll help relieve some tightness of the muscle knots and soreness, but it's not gonna take away the muscle knots, okay? That's one of those things you just have to get through, okay? You have to implement more dynamic warm-up and more working out once you've started to avoid constant DOMs, okay? Constant soreness. So I think it's important to note today for our lecture, foam rolling, self-myofascial release. If you have a tennis ball, highly recommend putting it in workout bag. Among some other things like bands are awesome. We'll discuss that later. But for today, foam rolling, those are some foam rolling exercises to take with you. Like I said, know the takeaways, know what they're important for, what they should be used for, what we shouldn't totally use them for. Okay, so that's all, and I will see you guys Tuesday.